Okay, it's 7 p.m., so we'll start the town hall meeting. I'm going to turn it over to the mayor, who I need to remember to unmute here in a bit, and get things started. Having trouble finding everybody. There's an unmute. Okay, but first of all, just a couple of housekeeping notes. When you logged on, everyone was muted. There is a raise hand button on Zoom that allows you to indicate that you'd like to speak. That's what we'll use today. This is a little bit of a test drive for us. We've never used this for a public meeting before, and so bear with us. We thank you for your patience in advance. We will try to get everybody who wants to speak an opportunity to speak. Folks that are observing on Zoom, thanks for joining us. Folks are also able to join via Facebook and via Channel 8. If we've turned the chat function off on Zoom just primarily because I'm the one operating it, and I'm already feeling overwhelmed, and I haven't even had to click a button yet. So we would invite those that want to post a question to do so on the Facebook feed for this meeting. We'll try to get better at this, particularly if we use it for our regular meeting next Tuesday. But I think if you enter in your, if you prefer to submit a written question as opposed to a spoken one, go ahead and do that through the Facebook feed if you can. You may also email us, and that will hopefully get to us as well. I need to check on the email address. Is there a specific one for this meeting? Okay. If someone would want to email me at matt.allen, matt.allen, at gardencityks.us, I'll have my email open to look at that. But would probably encourage people to do written questions through Facebook as much as they can. Okay, so with that, Mayor, I don't think I have any other housekeeping notes. Just remember, if you want to talk, do the raise hand function or button, and we'll get to you. There is a 2-hour limit on this meeting, so the format is one where we don't have an agenda. We do have two people that have agreed or asked to present. One of those is Dr. Lindsay Burns, and she'll be the first presenter tonight. And she's the medical director for the Finney County Health Department. I think we'll give a timely update on COVID-19 response locally. And the second is Melissa Doherty from the city staff, who is the person who's primarily responsible for the 2020 census. And so she's got a lot of good, timely information for us as well. And so those two folks will go first, and then after that we'll take people in an order that I can figure out how to operate the machine on. So Mayor, your turn.
Well, I raised my hand just so you can see that, Matt, just so you know. So the raise hand function does work. We want to welcome everyone here. I especially want to say thank you to the city commissioners. It's really great to see you. I didn't realize how much I'd missed you all. So I'm looking forward to when we can be in person. And Jennifer, if you, that cute baby, I don't know if that's going to work for me. If you keep showing her, we're looking forward to meeting her in person. We also want to just say thank you to everyone who's joining us tonight. We know that there's lots of things that you could be doing, and spending this time with us is really important, and hearing from you. And really, town hall meetings are meant to get a lot of input from you. And so with that, I'm going to turn it back over to Matt, and we'll get going.
Thanks, Mayor. Dr. Lindsay Burns, who I've just unmuted. Dr. Lindsay Burns has joined this meeting, and I'm going to let you go ahead and just start in. Thanks for joining us, first of all, and appreciate all the work that you've personally been doing. Thank you for being a resource to me and the rest of my staff as we've considered things for the City of Garden City organization. We couldn't have done it without you, for sure.
Thank you. Thank you for having me. Good evening, everybody. I do want to just go through some quick statistics. Certainly, I know a lot of folks have been following the KDHE website, update their statistics daily, as well as continuing to evolve the recommendations as we proceed through this pandemic experience. Also, I would encourage everyone to watch the things that are given on a daily basis, because this is a changing phenomenon, and as it's now impacting the entire United States are in this together. I will go ahead and tell you about the Kansas statistics. At this point, we have confirmed cases in Kansas as of today of 428 with 9 deaths. We have 1 confirmed case in Finney County. I will say that testing is still incredibly limited. And I can tell you from the Finney County Health Department, we've tested 12 people that we've resulted back. 5 are still outstanding tests. The hospital has 37 tests that have resulted. 19 are outstanding. And Kearney County, I understand, has 8 that they've resulted and 8 that are still pending. So I give you those numbers to help understand that we indeed are limited, and we are limited due to supplies. We are limited due to criteria, and that is a state mandate from KDHE. The updated guidance on who can be tested, and I just want to put this out there for the public because this has changed several times over the last couple of weeks, just as we have been trying to respond in the best way that we can responsibly with the equipment that we have available. So right now, the updated guidance as of the 23rd of March is prioritizing healthcare workers and first responders with symptoms. That's in an effort to preserve workforce, as you understand. We'd want to be able to test people, know if they need to be isolated or whether or not they're able to go back and serve in their capacity. Hospitalized patients that don't have an alternative diagnosis, and then individuals who are at high risk, and that being due to underlying conditions, sickness, or where they reside, in case you can understand if they're in a long-term care facility. Otherwise, we need to know about whether or not they're infected. As a health department, we are committed and as charged from KDHE to do contact tracing. I want to try and explain this a little bit further. This is an epidemiologic function. It is not trying to find any blame or assign any blame by any means. It is purely to provide the most information and get the most information to folks to be able to keep themselves safe and keep their family and their contacts safe. Anyone who meets criteria for testing is considered a person under investigation. That person is tracked through the state tracking system. We will call and find out who your household contacts are, where you've been, who you've been with, where you've traveled, etc., in an attempt to try and then track down other folks who might be in contact with you and who might be symptomatic or need testing. Ideally, we would do that on a very broad range, but then again, we are limited. We can offer tests. So we're trying to continue to let people know that they need to isolate themselves, even if we can't offer testing if there's been an exposure. I think we've heard over and over and over again from so many top national advisors, epidemiologists, doctors that are specialized in this field to say, at this time, we only have isolation and our behaviors to protect us. We don't have a vaccine. We don't have a proven antiretroviral. What we have right now is our behaviors. And Dr. Birx at the White House briefing today emphasized that as well. This is going to be a community-led effort. I know there are questions for the health department, inquiries about the state order, wanting us to interpret the state order. What I would ask is for everyone to do their very very best to optimize your isolation behaviors. Do that for you, do that for your community. I can't, you know, go through the ins and outs with everybody about what's acceptable and what's not. If you have to ask the question, I think you know in your mind how you can modify your behavior in the safest way. As a health department, we want to advise folks of the best practices. We want to give you information to keep you safe and so that you can make the best decision. And that's what we're committed to doing. So I'm happy to take any questions. I'll answer in the best way that I can.
Thank you, Dr. Burns. Certainly appreciate, again, all that you and your staff at the health department are doing. Would like to go ahead, and at this time, I'm going to unmute each of the commissioners in attendance to see if you've got any questions. I'm going to also figure out that's not the view I want, but commissioners, you're all unmuted now. Are there any questions for Dr. Burns?
So, well, I just want to, this is Troy Unruh. I just want to say thank you again for the excellent information that you are pushing through the Finney County Health Department. We really appreciate the work that as a community that we're doing together. And so as far as people and their homes, and what are you recommending? How often should they leave home? And we know that to get groceries and those kind of things, are there any things that we should be doing around our homes to make sure that we're protecting our families?
Am I back on?
You are.
Okay, excellent question. Yeah, I think that's very good. What I've kind of emphasized from the beginning is decreasing your touches. And it is, and I really appreciated the video that you put out, Mayor. Increasing your travel, and that means even travel to the store. Everybody's got to go to the store and get supplies, get groceries. We understand that, but do try and consolidate it. I think hygiene and washing down surfaces, washing your hands frequently, emphasizing that, and trying to keep that 6 feet apart, that social distance, is really, really, really important. We are human. We make mistakes. I have spent the better part of 2 days trying to explain to my 3 children why they can't play with the neighbors, and it goes against all of our instincts. But it is what we're going to have to do, just because of the nature of how this virus is spread. I want folks to know that, excuse me, and I've been coughing, so I've been isolating myself. That's sort of what you have to do. You have to take it upon yourself to say, I may not be able to get tested to prove that I have COVID, but I recognize that by coughing, by sneezing, by touching, I could be inadvertently spreading this to others. And I've tried to explain that to my children, and it's very difficult. It's very difficult as adults to understand that sometimes. So I would say whatever we can do to just try and decrease touches, keep that social distance, all of those hygiene pointers that have been emphasized over and over and over again. I think that's what we can do for ourselves and our families. Absolutely.
Thank you. Thank you.
I will say there has been some question about, well, so I've been coughing. For me, I will take myself. I've been coughing. When do I know that I can go back out into the world? And that is an unanswerable question with great accuracy right now. I will give you what the KDHE recommends, and I can tell you what's on the horizon for us to be trying to plan for that later on. At this time, KDHE says, if you've been symptomatic and have been isolating, you should be isolating for 7 days, or 7 days, or 72 hours after you no longer have a fever, without the aid of a fever reducer like Tylenol or ibuprofen, and significant improvement in your symptoms, and it's at least 7 days, because the caveat to all of this is the 72 hours after, whichever is longer. So if you were febrile for a couple days, and then you defervesced for 3 days, and you were only at 5, the minimum KDHE is recommending you stay at home is 7 days. I know that's difficult to understand, but again, isolate for 7 days or 72 hours after defervescence without any aid of a fever-reducing medication, and significant improvement in symptoms, whichever is longer. And I think ultimately, when we ask the question of, well, when will we know, who's had this, who's immune, even prior to having a vaccine, if you are listening to national guidance, and even Secretary Norman has talked about this quite a bit in his KDHE briefings, ideally what we would like to do is serology testing, which is different than the testing now. Right now, we're doing directed testing on symptomatic people, trying to find those who have disease and isolate them. That's the whole idea here. Find the person who has the disease, isolate them. With serology testing, we could go back and test and see if people have formed antibodies. So if they had disease, but they've recovered. And then if you have formed immunity after clearing the infection, then you would have a layer of protection. I better have you put me on Matt or on mute, Mr. Allen. I have children creeping in, and one of them is yelling. So.
Okay, I see that Commissioner Cessna had his hand raised.
Yeah, just a quick question on the testing. Mm-hmm. You said you gave us some numbers on the testing, Dr. Burns. How long does it take for the turnaround? We've heard 2 weeks. The president's talking about new testing procedures and getting that rolled out. But with the current tests, how long does it take to get the results back, have you seen?
Sure, that's an excellent question. And there is a lot of different information coming. I can tell you what we've experienced here on the local level. In the state, they are trying to guarantee a 72-hour turnaround. Part of it does depend on whether or not you can get the specimen there, because the specimen has to be delivered cold. It has to arrive within a certain time frame. And so that also depends on the delivery services. So when we can send tests, that's for the state lab. If you look at the state website, you'll notice that the majority of tests in Kansas are being done through private labs, either LabCorp or Quest. And that's what the hospitals contract with. That turnaround has been significantly longer, on the order of a week to 10 days. And so the difficulty with that is, if you have someone in the hospital for 7 days to 10 days waiting on whether or not they have a test, they're in precautions. And so everyone who goes in and out of that room has to use PPE. Obviously, that person we're trying to do contact tracing on, but it's hard to tell, what are we really dealing with? How deep do we need to do that contact tracing? Those kind of things. So it's very difficult having a long lag time. They've talked a lot about this new Abbott test that is a point of care test. It's a point of care piece that turns around in 45 minutes. I understand that those have been deployed to Detroit. I'm not sure when one will arrive in Kansas. The limiting factor in our testing has been the platform at the state lab to be able to run those. Secretary Norman talked about it at length last week. At this time, the capacity for KDHE to run the samples was about 75 a day. They were supposed to get a new piece of equipment that could run up to 1,000 per, and that's supposed to be online this week. I haven't heard confirmation of that yet, but then at the same time, we're still limited by some of the reagents and the swabs to be able to do that. I understand with this Abbott test, that is the quicker test, that Abbott is supplying thousands upon thousands of swabs that come along with that, but that has not been deployed to Kansas as far as I know.
Thank you, Dr. Burns. I've got a couple questions that are on the COVID topic, and so instead of making those people wait till you're off, I think if it's all right with the mayor, I'll go ahead and ask some of those that have shown up on Facebook. Is that okay? Mayor,
That's great.
with you? Okay. All right. And I'm gonna kind of group these together. One question, and this is submitted by Brandon Carmichael, and then another one that's very similar, I think, from Zach Van Hubbard. With limited testing and a confirmed case in the county, it seems like the virus is here. Is it wise to keep something that attracts people from outside the community, such as the zoo, open, if there's no other benefit to keeping it open, such as admission? And then the other question, which I'm lumping in, is why is the zoo open? So from, I think one of those questions is probably more administrative or for the commission, but Dr. Burns, you've been certainly involved in some of the discussions just about how public agencies handle their business, and you might, if you don't mind, weigh in on the what does it mean to have a confirmed case in town, and you know, what I guess what criteria should folks use, public employers or maybe private places too, about staying open, not staying open?
Sure. Yeah, no, I absolutely, the virus is here. By the time that you have a confirmed case, it's estimated it's been circulating for 2 weeks to a month. Now, there are some definitions that you will hear about what is a community spread caseload and those kind of things, and it is dependent on your ability to test. You'll hear in Johnson County, it's been determined that we have what's called community spread. Well, that means that there are at least 5 different confirmed cases that don't have known connections or contact or weren't in the same clusters. So we have not been determining that we have community spread in Finney County as yet, but again, that is limited in our testing. So with that caveat, as far as bringing other people into town, I guess this is what goes to my plea, is that this is a personal responsibility and a personal decision that folks have to take and say, what behavior should I be doing to keep myself safe? Now, with regard to public, whether it be a golf course, whether it be public parks, whether it be the zoo, those kind of things. There are operational things, obviously, that the animals have to be taken care of. Should it be open to the public? Well, how could that be done in the way possible? Now, this is kind of along in the same guidance that's been given to parks and recreational facilities. Maintaining appropriate social distancing. So even if you're on a hike in the mountains, you need to stay 6 feet away from each other. Or if you're walking through the zoo. And there are, surfaces, railings, kind of things you could touch. I would advise not doing that. We can try and keep them as clean as possible, but at the same time, there are those kind of risks in the same way that there are risks when you touch the grocery cart and those kind of things. I think this is where the personal discretion comes into play. Whether or not the city decides to close the zoo, I think is an administrative decision, but they gave me a plan as to how they could risk mitigate in the best way possible and still keep that facility at least open to walk through traffic. And I looked at it and I thought that was probably fine. It is, again, kind of goes to the to make good decisions and know maybe you could walk through the zoo but not touch and still enjoy being able to walk through the zoo. There is an element here that we have to, I want to say, live with the virus and not spread. So there's part of this where you do still need to exercise your body. You do still need to breathe fresh air, those kind of things. We can have a policy as to whether or not the zoo is the right place to do that. But I guess I also think that we have to think about how to continue to be able to exist in the world in some way. Staying in home and an at-home order is useful with the idea that you need to pretty much isolate with your household. But I think that we need to have some opportunities, especially, you know, if you've got 3 young children like I do, for some sort of recreation as well that can be done in the safest possible way.
Thank you, Dr. Burns, and thanks for that question as well. There was one other question from that I thought was sort of like that, but not exactly. I want to at least acknowledge that the person asked the question, Sonia Roth, had asked, with limited testing and a confirmed case in the county, should we assume there are many more cases here in Finney County? I think you've addressed that as best you can in your presentation. And she adds a comment that she feels like the younger generation should stay home, and that understanding that would be understanding that there could be a greater presence of COVID-19 in the community might help them understand that. Would you add anything to what you've already said, Dr. Burns, in light of that question or comment?
No, I think that that's right. And I think that it absolutely, I mean, I don't want to encourage everyone to crowd into the parks. There's a reason we have the playgrounds and those things roped off, but I think that you can stay home and yet still exist and be healthy in your behaviors and those kind of things. But you're right. Everybody needs to take this quite seriously. It is here. We are not protected being in Garden City, Kansas. We will experience this as the rest of the world will. And part of this is still trying to maintain a community fabric without touching each other, without that social closeness, that physical closeness. And yet we still have to maintain a sense of community and togetherness and helpfulness. And there are essential functions that must go on, and we have to figure out how to mitigate that risk in the safest way possible.
Okay, other comments on Facebook that are maybe a little bit different but related. Margaret Opholz talks about the walking trails and also in the parks, the playground equipment. I think you'll see those common touch areas are, I think, as Dr. Burns has helped to review our plans and advise us, have been discouraged, where possible, roped off while the parks are still available, just kind of, again, limiting common touch areas. And of course, all of these strategies as we evolve through this are under review and could continue to be changed. Some follow-up comment from Mr. Hubbard on the zoo. Answer, Melody Garcia, comment about we won't know it's spread until it's too late. It's a comment, not a question, but I think you've spoken to, Dr. Burns, the nature of the virus, the nature of the symptoms, and the delay or inadequacy of testing. And Chris Moan, thank you. Whoops. Chris Moan, thank you for your comment about, well, I guess it is a question, what about zoo staff and their families? and the risk for working there. You know, I think that one's more administrative, but again, in your relationship, Dr. Burns, in reviewing it, reviewing the plan, certainly whether it's regardless of the person on one side of the 6-foot distancing or the other side of the 6-foot distancing, whether it's a public employee or 2 members of the public or 2 employees. I think you're looking at this and helping advise not just us, but other people on what the CDC recommends and how we might be able to apply that in our workplaces. And yes, certainly we're all in the mode of trying to limit risk and balance policies. Carrie Dawn Miller. This is a good question, Dr. Burns, and I think I'll end with reading the Facebook questions on COVID-19 and look through Zoom while you're answering this. What is a diplomatic way to address people infringing on that 6-foot circle? So if someone's kind of getting a little too close, what would you recommend as the way to get out of that situation?
I'm probably not the one to answer this. I work as a hospitalist, and before I was coughing, I took myself out when I started coughing, obviously, but I had a very nice 85-year-old lady try to hug me, and she was standing on her side of the room, and I was standing all the way on the other side telling her that she was discharged to go home, and she started to walk towards me, and I pushed everybody behind me out of the way and ran backwards. So that maybe wasn't diplomatic. So it's very difficult. And like I said, it goes against every human instinct we have. What I have tried to do all along is just remind people, encourage people, say, hey, you know what? I recall going to meetings early on in this, and people sitting down next to me and to shake my hand, and I would say, I'm not going to shake your hand because I care about you, because I respect you. And it's a complete relearning of how we interact with one another. And so I don't think that people, I would say I would hope that it's the very small majority who are infringing upon others' space intentionally with malice. I think it's just our natural human instinct, and to constantly have to just remind and reinforce and do those things that now shape us as a society that looks different. Our meetings look different now. We should be sitting farther apart. We should, and even if you watched the White House briefings, for a week, they were all standing up there shoulder to shoulder so they could all be in the camera shot. We just can't do that anymore. And it looks different. And the idea of only, a few people going into a store at once, it's really going to be quite interesting for us as a society to figure out what we continue to do. And I think a lot of these behaviors will be good.
The last part of that cut out. Oh no, that's because I muted
contagious diseases that could probably very much be lessened if we would adopt some of these social practices. So this is kind of the crash course, but we are going to have to learn how to navigate that, all of us. And again, we're human, and we have to kind of keep making reminders and keep trying.
Commissioners, I've unmuted all of you. Is there anything else that you'd like to ask of Dr. Burns before we let her go? Seeing nothing, thank you very much, and we appreciate the update, Dr. Burns. I know we'll be in further contact over the coming weeks.
Thank you, everyone. Stay safe.
All right, next I'm going to invite Melissa There she is. I'm going to unmute you, Melissa. You're up next. This is an update on Census 2020. And I'll let you take it away.
Great. Well, thank you, Commissioners, so much for allowing me to speak tonight on this timely topic. We are at the 31st. Tomorrow's April 1st. That's no April Fool's joke. It is Census Day. So if you're filling out your forms tomorrow, definitely post a pic. We'll post it on the Facebook page, or if you've already filled it out, just go ahead and take a pic, say I did my part, I count for Garden City, and post those pics. I'm going to give you guys some statistical updates. Won't be as interesting maybe as the COVID-19 statistics, but here's some response rate data that we have. So right now, the national response rate is at 36.2%. Kansas is at 40.8%, so we're ahead of the national average. Here in Fitty County, we're a bit below the national average at 30.2%, and then Garden City is above the county average, still below the state at 31.1%. They are trying to do the census operations as much as they can with the COVID-19 virus as business as usual. Some of the field operations have been delayed till August 15th. So the early non-response follow-up, the non-response follow-ups, those will be delayed right now till April 15th, and that includes training of the census enumerators. We expect that to see some enumerators in our area more towards mid-May as the estimates that they're giving from the census. And the deadline for responding to the U.S. Census has been extended. Instead of responses due by July 1st, the census responses are now due by August 14th, 2020. So you have an extended month and a couple of weeks to get that survey filled out. Hopefully nobody will wait that long and somebody will respond by online or by phone. It's really easy to do. All you have to do is go to mycensus2020.gov. If you don't have your personal identification code for your household, do not worry. You just log on and say, I don't have an access code. You'll fill out your address information and you'll be able to answer the 10 questions. It's so simple to do. I did it on my cell phone. It took me 7 minutes. That was just for me and my husband. So it doesn't take very long at all. It runs really smooth on mobile devices. My mother did hers on her iPad. It's just her. So it took all of 5 minutes to get those questions answered. We are, unfortunately, our partners at the Finney County Library and Genesis Health Centers and others that we partner with, those events are on hold right now. We aren't canceling anything. We've just put them on hold until the stay-at-home order has been lifted, and then we will reevaluate at that time what events we will hold. Due to the extension of the survey response time, actually gives us through July to get more word out and make sure that everybody gets counted. So I'm a little excited that we get to go all the way through summer versus just midsummer. There's been a question about PO boxes because a lot of those addresses get hand delivered responses, and we have been informed that postcards did go out to PO boxes notifying people that they can respond online. We will be posting some posters at the postal offices in Holcomb and Garden City. I talked with both postmasters today and encouraging them to put as many posters up so people can know that they can respond now. They don't have to wait to get anything in their PO box or the paper survey. It's very easy to go online. It's very secure, and then provide a contact phone number for them to call. You can call in 13 different languages, as I mentioned on the 17th City Commission meeting. And We hope to have a Facebook Live event tomorrow going over some of the questions. And if we can't do it tomorrow, since we've all been scrambling to get used to Zoom and Facebook Live, we may postpone that to our Census Saturday. So if you haven't friended the city's Facebook page just yet, every Saturday, Jamie and Lauren have been fantastic partners in making sure that they're spreading the word. Sarah from the county has been spreading the word on their page through Finney County website. So we're doing our best with the limited resources we have as far as not being able to go out and talk to people and be at events. It's a little frustrating for me because I love talking to people. So we are trying to get the word out there as much as possible. Please, please, please share, talk about the census as much as you can. And another issue that's come to our attention is I've been receiving a lot of questions about college students. So I'm just going to go over some of the information about how to count college students since classes are on hold. Students that normally live at school are to be counted at school. So even if they're temporarily living elsewhere, they're still going to be counted if they've lived in dorms, fraternities, or sororities that are on school property. If you are living off campus and not at your off campus address, you'll still want to respond to the census with the address in which you've lived more than 6 months and 1 day at. So typically students that have an off-campus apartment here, they moved to Garden City, but they may have gone back to Oakley during this stay-at-home order, they'll still want to report their census information for Garden City address. Those students living off campus should have still received mailers to their individual addresses. And of course, if you normally live with your parents during the school year, then those college students will want to make sure that they get included on their parents' form. At this point, that kind of wraps up all the hot topics that I've got from the census and information that we've received. It seems that we aren't doing the daily changes or getting daily updates anymore, so I'm glad to see that. And we're just kind of waiting to see what's next and waiting for that stay-at-home order to be lifted so we can get out to events and encourage people to sign up and do anything we can to assist. And I can now take some questions.
Thank you. Commissioner Cessna, you had your hand up.
Yeah, I just wanted to mention, because we're doing virtual schooling in the district, as a family, we did the census together, and our teachers asked about, well, one of our teachers for my child asked about the census and how that went. So, and he kind of explained because we did it as a family. So, and you're right, it takes about 10 minutes. I mean, for the 10 questions, if you work through it. So I know some of the teachers are working on their end to promote the census in the district.
Fantastic.
Commissioner Ortiz.
So I just had a question on when people call in through the phone line, do they have options on different languages? Is that an easier way than just to fill out the form online?
It is if you have some, if it's harder for you to read English or understand what they're asking in the English form, then I would recommend calling the phone because you'll actually be speaking with somebody that can help you go through the questions. We have over 59 question guides, and that's actually what I'll be using on the Facebook Live is just going through one of those, kind of going through the questions. So yeah, call in. There's an English number and specifically a Spanish number, and we're trying to advertise those numbers on all of our communications as well.
Okay.
Any other questions from commissioners? Looking around to see if there's any census questions on Facebook Live. It doesn't appear there is. Melissa, thank you. Thank you for the work that you and the Complete Count Committee are doing. It's fantastic. And I know you'll handle this curveball just as well as you've handled everything up until this point. Thank you very much. Commissioners, at this point in time, the kind of the traditional setup in town hall meetings is what we'll do. We've got the opportunity for folks that want to address the commission to do so. There's 2 raised hands I see, so I'm going to try to figure that part out. So bear with me, this part will be clunky. As a matter of just protocol, I'm going to ask that folks, I'm going to try to identify you with the name that's on the screen, but when you begin talking, if you will identify yourself, and so the commission knows who's speaking to them, I would really appreciate that. And I'm going to unmute Tyler Almond. No, I'm not. Sorry, Tyler, I'll figure out what happened there. He had his hand up. Well, there were 2 hands up, and now there's 0. I'll wait a little longer to see if that changes. Anybody joining us on Zoom that would like to weigh in? Oh, got a couple more. So there's a new question on COVID-19. I just happen to know, have an update on that. So there was a question on food trucks. In particular, there was a food truck that had been advertising over the weekend to be in Garden City that had been in Colorado. I know that the city clerk and city attorney had worked on that over the weekend. They were able to obtain an itinerant merchant's license. The governor's order didn't explicitly address something that would prohibit them from coming in, at least under the city's authority to issue an itinerant merchant's license. However, the Finney County Health Department, under the authority given to them under this situation, did have the ability to stop that, and had indicated to us their desire to do so. And so in the process of us, this happened later this afternoon, communicating with that food truck. The health department had also reached out to them and told them that it was their intent to use their authority to direct us to not allow them to do business here tomorrow. And they voluntarily withdrew their request, and the city reimbursed them for the itinerant merchant's license fee. So that's an update on that. Anybody else have a question or comment for the commissioners? Okay, I see Christopher has raised his hand. I'm getting to you, Christopher. Bear with me. All right. Christopher, you are on.
Hello? You guys hear me okay? First off, I want to say I am not a natural speaker, so bear with me. Thank you all for hearing me, first off. As the spouse of a... Sorry, super nervous, not a natural speaker. Okay. As the spouse of a keeper at the zoo, I would like to ask the commission, personally, can you guarantee the safety of the staff and their families, for that matter. There are a number of people in each of these families that I don't know if they are high risk or not. I know living in our household, we have someone that doesn't have health insurance. I know living in a variety of other households or kids one of the keepers has a 1-year-old daughter who has had problems before. Can you guarantee with certainty that the keepers are safe? And if not, what is the reasoning for keeping the zoo open to the public and exposing the risk? I know a number of the people are doing as much as they can to reduce their risk in their everyday lives, as it also endangers the animals. We do not know what animals this could potentially spread to, especially the primates that are there. And I think that's summing up my questions. So thank you for hearing it. I apologize for my nervousness. Once again, not a natural speaker. With that, I give it back to you guys.
Chris, you did just fine. Thanks for the question. Commissioners, I'll unmute you if anybody feels the need to address it. I think the expression of concern on the part of Christopher was certainly clear, and that was the point he wanted to get across, as probably between that and the Facebook comments, you know, an opinion that certainly I understand that believes that the zoo facility should be closed. Okay. Christopher, again, thank you for your, Mayor Unruh has a hand raised.
Yeah, I just wanted to say thank you to Christopher for speaking up, and we appreciate the concern. And you know, we all have loved ones in this community that we want to keep safe, and so I think that hearing that you also are the same, and I appreciate the willingness to step up and say something. So I think that's I think it's on behalf of on behalf of us as city commissioners, and I know that me personally, I really appreciate just your concern and your comments, and also you can hear the love for your family and also for our community. So thank you.
Okay, Tyler is back raising his hand. Tyler, I'm probably the one that messed it up last time, so bear with me and I'll get to you. Tyler, I keep hitting unmute on you, man. I don't know what the deal is.
You're actually clicking it on me.
You're good.
Yeah, you're not clicking it on Tyler. Tyler, you're clicking it on me.
There you go.
Oh, hello. Hi guys. So I'm
There you go.
Tyler, and so I've been searching this up like a lot on the internet, and there's like a debate between what's right and what's wrong. But is it safe to order packages on Amazon to get delivered to your house?
You like my question?
Yeah, someone asked.
Can we already ask that?
Hey, Tyler, so is this, your question, is it safe to have packages delivered from Amazon or?
Amazon.
Yeah.
Due to the coronavirus, would that be safe?
We probably lost our resident coronavirus expert when Dr. Burns jumped off, and I certainly don't feel like I could probably weigh in with any medical expertise on that.
Oh, okay.
But I tell you what, I will. I'm going to give you my email address. If you didn't get it at the start of the meeting, it's first name dot last name, matt.allen at gardencityks.us. If you'll send me an email, I'll connect you and Dr. Burns via email, and I think they'll give you the best advice that they can, at least from your local medical director of the health department, if that's okay. Sorry, I can't.
All right.
Sorry, I can't
It's
answer
okay.
that.
Thank you.
And I bet the first time I was trying to unmute you, you probably could ask that question directly to her.
It's all good.
Thanks, Tyler. Okay, other questions in the town hall meeting? All right, seeing none, Mayor, do you have any comments, or does any of the commission have any comments?
If we can go around the horn and then Matt come back, and then we can just kind of finish up. Will that work?
Okay, I'm just going to start with who I've got underneath my mouse cursor. Commissioner Dick, do you want to conclude with anything?
Okay, I'd just like to say that I know you guys are reassessing the situation daily. So when we're talking about issues with the zoo, and as we get more information in, and as we learn what is and isn't safe, I know you will be taking that into consultation with Dr. Burns and staff like that. So from my commissioner standpoint, I'm viewing is what the city is deciding is probably the best guess at what's the best thing to do at this time. So that's kind of my 2 cents on that zoo question that keeps on coming up. The other things I like to say just really quickly is I really appreciate what the community members of the city has been doing to do things that are appropriately for social distance, but also still brings us together as a city. So things like the bear hunt that's going on and those other sorts of things is really good to see that our community is strong enough to get past obstacles that we have, and we still can come together as a community. And that's been great to see as this has been going. The last thing is I want to give a big shout out to the school district, both school districts, for the tremendous undertaking this has been to get that many staff members and that many kids all together and have a whole new paradigm for how we're doing learning. And then to see for these first 2 days, at least with my girls, to see it actually is working. It's very commendable that to the job and the effort and everything that's going on in the food program and having the food available for the kids. The school district has really stepped up and it's good to see that our organizations are doing as best as we can. So that's all I have to say. I don't know what quality my audio is. It's probably not very good, so I'll stop there.
Thank you, Commissioner Dick. Commissioner Euler? Oops, sorry.
That's okay. I know my husband wishes that there was a mute button in real life too at times, but again, just I wanted to reinforce the decisions that are made, and it is hard to make these choices and knowing what is right, and do we stay open here or do we close this, and so as information comes in, then we're able to make those decisions. I know Matt and Jennifer and all of the department heads and everybody else who is involved in making those decisions weigh all that information carefully. And but as commissioners, you can always reach out to one of us and let us know what you think. That's why we're here. And so if at any time you have any questions, please don't hesitate to do so. And also, I just wanted to reinforce the census. It is very important that we do complete it, and it is very easy to do so. I'm really looking forward to tomorrow with putting out social media and Facebook stuff regarding the census. So thank you, Melissa, for everything. And also, I wanted to thank parents and teachers and students and everybody else, because as Commissioner Dick said, you know, this has been an ongoing issue. I know that my high schooler has, I don't know, she's probably working harder since I'm actually here watching her. But it's really been an adventure, but it's been one that I'm so glad that as a community, we're pulling through and doing things to get through this, and we will get through this. So, you know, hats off to everybody who's doing this together.
Commissioner Ortiz?
I would just like to say that we are trying to do our best in deciding what is best for the city of Garden City. I know, again, all these questions arise, even by neighbors that we have next door, by our kids that, you know, can't go outside because they're told, you know, there's things out there that we don't need to get. But we can't guarantee any safety to anybody. I know that's tough to say, but in reality, it's our duty to do what is best for ourselves. If everybody is on board and looks at it that way, that I've got to do what's best for me. Granted that some people are going out and, you know, going through drive-throughs or going shopping, grabbing your shopping carts, whatever. It's a tough decision. It's really tough. And I don't want to say that we shouldn't value anybody's health or lives. This is something that we all need to take seriously. And I think we are. The city's on board with trying to do the best things that they can with what we have. Socially, we're just trying to adapt to this new world that we have handed to us now. I'm for just safety on everybody's position. I know this is more of a town meeting, not necessarily something we could actually vote on yet. So it's up to the city administration to handle this the way they handle it best. So with that said, I think it's just safe to say that we should all just do our best in walking, you know, in paths that aren't crowded. If you don't want to go to the zoo, you don't have to go to the zoo. If you don't want to go to Walmart or anything like that, you don't have to go. I'm not trying to put words in people's mouths or anything. You know, we have to see both sides and kind of weigh in our options and what the best options are. So we don't want to ignore anybody's comments, or we don't want to ignore anybody's safety. We just, I think we just have a pretty big weight on our shoulders that we need to kind of discuss and go through and walk through with everybody's concerns. So.
Thanks, Commissioner. Commissioner Cessna? Commissioner Cessna, can you hear me? Okay, I'm gonna try one more time. Commissioner Cessna, do you have a comment in closing? Evidently not. Commissioner Unruh, or Mayor Unruh, sorry. There we go. Commissioner Cessna, sorry.
No, you're fine. Just wanted to kind of piggyback on everybody. Again, safety is the word that everybody's using, and it's important, especially in this time. You know, the governor's working to try to keep everybody safe in our state, and that's why she imposed the order she did this weekend. We're trying to follow those guidelines. Again, it's the rule, if you please stay home if you can. It's not like in the news release, it wasn't not martial law, but you can still get out and get the essentials. You can still get out and move around. It's just trying to reduce the contact between people. Again, the rule of having no more than 10 people and using the distancing of between 6 feet between everybody. The other thing, the census, and very important, especially in what we're dealing with right now. I remember at our last commission meeting that we had together as a group that they were talking about that the census is important. It helps provide resources to various areas with an accurate count. So please, again, like I said, it takes, and like Melissa mentioned, less than 10 minutes. There's 10 questions. It's really easy to get on and do. Something right quick. Thanks for all the kudos from the other commissioners on the school district. Some quick statistics for you. Last week, we served over 30,000 meals to students. We handed out over 4,500 iPads to students that didn't have them for virtual learning. And we put together a continuous learning plan in 1 week and implemented it and started it this week. So our school district staff has done an outstanding job, really working to continually educate our students in these ever-changing times that we live in. The other thing I wanted to mention is that you can do together as a family and to help our community is the city management has noted or has extended the spring cleanup. So you see, if you're out, and I have to move around a little bit in the community for my job, but if you are out and about, you see there's piles out in the community, and it is our spring cleanup. So helping to clean up our community, and it's something to do as a family. Get out, and if you have any items that you can put on the curb, on the city's website, they do have the maps of the different days that the pickup will be taking place. So another family event that you can kind of work together on as a family while we're trying to stay in home. That's all I've got. Thank you.
Thank you. Thank you, Commissioner Cessna. Mayor, I'll let you finish up.
Well, again, thanks, Matt, for being the host of the Zoom meeting. I know this has been quite an experience for all of us, and I just want to make sure and say thank you to Dr. Burns for being here this evening, and Melissa also for reminding us that the census is important. The statistics were really great, and I hope that you continue to post those. One thing I wanted to talk about, United Way did some things with some local heroes, and really each one of us can be a local hero. It's this idea that more is caught than taught. So if you model the behavior Commissioner Cessna and really all the commissioners have talked about, here are some things that we can do to keep ourselves safe. And so if you model that behavior, it's really going to make a difference. Just to remind one another and all of us that kindness goes a long way. This is a new normal for all of us. I didn't realize how social I was. Now, we were on our way to becoming empty nesters, and then we've had a couple of college students come home, and I'm going to stop with that right there. And it's been a lot different than I thought. But I'll tell you, everyone is experiencing loss in our community. And so just the kindness, and I know listening and talking about the things that you have to look forward to can really make a big difference. Summer is coming. I know there's lots of things planned. And so just making sure that we're looking toward the future. I mean, we're living in the present. The past will soon be behind us. We can't change that, but we can certainly change our future. So Matt, I just want to again say thank you, and all the commissioners, thank you for doing tonight's meeting. It was a neat opportunity. Everyone who came on tonight and all those who have been with us during the Zoom meeting, it is incredible attendance. We'll have to try this again. And for those of you who spoke and said something, thank you so much, because we know sometimes it's not hard. It's not about being a great speaker, but it's really more about the content of what you say and with your heart. So until next time, we will be talking to you soon. We have a commission meeting coming up here next Tuesday, so we'll be looking forward to that also. Have a good evening, everybody.
Thank you. Have a good evening, everyone.